Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer and Amazon #1 best-selling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. Our guest today is Dr. Greg Hammer, MD. Dr. Greg Hammer is a professor at Stanford University School of Medicine and an expert on the vagus nerve. And if you're anywhere in the world and you have stress, you need to hear what Dr. Hammer has to say. And you can find out more about Dr. Hammer and his wonderful work at his website, greghammermd.com. Welcome, Dr. Hammer.
Wonderful to be with you, Catherine.
Now, for our audience, I have to share with everyone what happened right before we started recording, because I'm in Atlanta. There's a hurricane coming up the Gulf. And last night, there was heavy wind and rain. And the heavy wind and rain ripped the siding off the side of my house. So I have a gaping hole in the side of my house as we speak. And right before we started recording, I was explaining to Dr. Hammer that if I'm a little grumpy, that would be why. I said, it's not you. I said that to him. And he told me to take a few deep breaths. And of course, me being grumpy, I was like, well, I already know that. But so Dr. Hammer, can you explain for our audience what the simple act of deep breathing does for us?
That's a great question, Catherine. Actually, deep breathing does a number of things for us. We all suffer from chronic stress to one degree or another. And when we're stressed, we often don't think about our breathing. Our breathing is regulated automatically by the sort of reptilian brain or brainstem. So we don't often think about it, except when we're in your yoga class, for example. But when we're not thinking about our breath and when we're stressed, the muscles in our chest become contracted and the muscles in our abdominal wall, our belly, become tight, and we're not really breathing deeply. And we can go for a day or days without really taking a deep breath. Maybe if we yawn, we do, but otherwise we can go for quite a while without really expanding our lungs fully. And that just sort of perpetuates the stress. So when we do take a slow, deliberate breath, and we start my gain meditation by finding a comfortable place to sit and closing our eyes and breathing in slowly to a count of 3 through our nose, pausing to a count of 3, and then slowly releasing the breath without effort to a count of 4. And we're breathing really into our belly, expanding our chest, but also expanding our belly. And as we do this, we're letting go of stress. We're activating the vagus nerve, which we can discuss. We're also reopening some of the tiny air sacs in our lungs that have closed. So those little tiny air sacs where the gas exchange takes place between our lung and the bloodstream. Those little air sacs are called alveoli, and when they're collapsed, it's called atelectasis. There won't be a quiz at the end, so if you don't remember this, there's no problem. But you can imagine that we have sort of microscopic collapse of areas of our lung when we're not breathing deeply, and even normally, some of our lung is a bit collapsed. And so when we take these slow, deep, deliberate breaths, we're opening those air sacs, and that increases the amount of oxygen in our bloodstream, and therefore the oxygen delivery to our brain, to the heart itself, to all of our organs. And so there are so many benefits to slow, deep breathing, and we can get into that further. But I think when we're stressed because we've had either something relatively minor or major going on in our lives, it could be a storm and damage to our house, we tend to contract the muscles in our chest and our abdomen. We tend not to take these deep, slow breaths. And therefore, we have this atelectasis. And if we just sort of pause, focus on our breath, if we can be with our eyes closed somewhere relatively quiet for just a few moments and take these slow, deep breaths, there are lots of benefits to our physiology.
Thank you, Dr. Greg Hammer. I love that explanation. I always explain to my yoga students that the simplest way to tell in any moment whether or not you are stressed is by whether you're breathing into the belly. Because when you have two sides of your nervous system, the sympathetic and the parasympathetic, and when you're in the parasympathetic side of your nervous system, your breath goes naturally down into your belly. So, and then Dr. Hammer pointed out before we got on the air, he said, well, Catherine, just think you only have a hole in the side of your house. You know, think about the people in the Ukraine who are experiencing constant shelling right now. So again, our heart goes out to you if you're listening to this broadcast. If you're under any kind of stress, Dr. Hammer's got some really important information that you need to hear. So first of all, Dr. Greg Hammer of greghammermd.com, what exactly is the vagus nerve and what role does it play in maintaining equilibrium in our body?
The vagus nerve is a long nerve that emanates from the lower part of the brain, and it passes down through our spinal cord and then sends branches to many different parts of our body, to our lungs, importantly to our heart, but to our digestive system. It also sends branches up to our organs in our face, our eyes, for example, our salivary glands. So it really has ubiquitous effects on the body. And as you pointed out, we have generally a balance between our parasympathetic and sympathetic nervous systems. And the vagus nerve is the primary nerve for our parasympathetic nervous system. So, you know, like every other function in our body, really, in the main at least, there's a balance between opposing forces. So we have, for example, with regard to our state of awareness, wakefulness, we have excitatory input to our cerebral cortex, including the centers that regulate our level of alertness and wakefulness. And we have inhibitory pathways. And I talk about this with my patients because if I'm taking care of a child in the operating room, since I'm a pediatric cardiac anesthesiologist and intensivist, and we may have them go to sleep by breathing anesthetic gas. And sometimes the parents are present. So I really want to prepare them for what they're going to see in their child. And as the child is breathing anesthetic gas and becoming anesthetized, they often have an increase in their heart rate, an increase in their breathing rate, their blood pressure may go up, they start moving around. They're not really awake anymore as they're breathing the gas. But there are these signs that can be very disturbing to parents. And I prepare them and tell them that we are disturbing the balance between the excitatory and inhibitory input to the brain by giving them anesthesia. And as they're breathing this gas, the side of the nervous system that controls their wakefulness, for example, is again, comprised of excitatory and inhibitory pathways. And we're anesthetizing preferentially the inhibitory pathways at first because they're more sensitive to anesthesia. So why is it we're giving this central nervous system depressant gas and they're becoming excited? It's because we're suppressing the inhibitory side of the nervous system preferentially at first with the sort of lower concentrations of gas that gets to their brain. So they get excited. And then after a minute or so, the excitatory pathways will also be anesthetized and they'll settle down. And this is the same reason why people are in a bar, maybe they've had a couple of drinks and they actually get excited, right? They become talkative. Sometimes they get rowdy. Why are they taking something that depresses brain function, namely alcohol, and they're getting excited? It's because they're initially at low levels of alcohol in the brain. They're suppressing the inhibitory side of this awareness, alertness part of the nervous system, and they're getting something we call disinhibition. They're getting excited. So the body is full of these examples of balance, hormonal balance. We have insulin that tends to lower our blood sugar, glucagon that tends to elevate our blood sugar. So we have this part of our nervous system called the autonomic nervous system. And you could think autonomic, automatic. So these are brain functions that we normally don't think about, such as those that regulate our breathing, our heart rate, various other bodily functions. As I said, the vagus nerve has branches that go almost everywhere in our body. And so this is our autonomic nervous system. And we have the sympathetic nervous system, the sympathetic part of the autonomic nervous system that is excitatory. So think fight or flight. Think our heart rate's going up, our blood pressure's going up, our cortisol is going up, so our blood sugar is going up. Lots of excitatory things are happening that are preparing us to run or perhaps fight off a predator. And that system is normally balanced by the parasympathetic part of the autonomic nervous system, and that's largely driven by the vagus nerve. So when the vagus nerve is activated, the opposite things happen from our fight or flight or sympathetic autonomic nervous system. In other words, our heart rate goes down, our blood pressure goes down, our blood sugar settles down. We feel a sense of calm. And so there's this balance. And unfortunately, when we're chronically stressed, the sympathetic nervous system is sort of winning out. And we may have a chronically elevated heart rate, hypertension, that chronically elevated blood pressure. Our blood sugar may be chronically elevated. Lots of things happen that might be good in the very short term with acute stress, but are very deleterious to us in the long term with chronic stress. And so here we are talking about the vagus nerve, which is our means of combating this chronic stress and all of those adverse physiologic changes that are imposed by chronic activation of our sympathetic nervous system.
So, Dr. Greg Hammer, I was really excited to speak with you today to really help people understand the vagus nerve so much better. Because a couple of comments. As a medical intuitive healer, people want to understand, how did I get this way? How did I get so sick? And so if you want to give a simple answer, it would be stress, right? So, for example, my clients with chronic digestive disorders, Crohn's disease, colitis, every single one of them, they're literally stuck in the sympathetic nervous system. It's like they want to relax, but at a deep physiological level, they're stuck in the stress. And also a lot of my chronic pain people, it's like they're just stuck in this chronic overactivation of the back of the brain. And so going back to the vagus nerve, so how many branches does the vagus nerve have in the body?
I can't give you an exact number, but you can think of all of the mechanisms that occur in our body that require this balance between excitatory and inhibitory forces, mainly involving systems that we don't normally think about or we don't control we can control them with our thoughts, but they happen whether we're actively thinking about them or not. So dilation or constriction of the little blood vessels in our body. We talked about the branches of the vagus nerve that go to the heart, primarily the part of the heart, which is in the right atrium, which is called the sinus node, that regulates the electrical system of the heart. The heart determines what the heart rate is. So the branches of the vagus nerve that go to the sinus node in the right atrium of the heart. There are branches that go to the little airways in our lungs. There are branches that go to the organs in our abdomen. There are branches that go to our skin because, as you know, the blood vessels in our skin can be constricted, in which case our skin appears pale and cool, or they can be dilated and we get flushed. We may perspire. So really, I would say again that the vagus nerve is ubiquitous in the body in terms of its branches.
Now, Dr. Greg Hammer, what exactly is the parasympathetic nervous system and how is it affected by the vagus nerve?
Well, actually, Catherine, the parasympathetic nervous system is the nervous system, the automatic nervous system that opposes or keeps in check our sympathetic nervous system, which we can recognize as the fight or flight excitatory side of the autonomic nervous system. And its primary nerve is the vagus nerve. So the vagus nerve is sort of the warrior, if you will, of the parasympathetic nervous system. It really carries out the function in large part of the parasympathetic nervous system, and it originates in our brain stem, in our lower brain. And as I said, it runs down our spinal cord and then sends branches off in our chest, in our abdomen, in our lower body, and up into our head as well. So you can think of it really as the sort of providing the balance to our sympathetic nervous system throughout the body. And again, most of the branches go to tissues and organs that involve functions that we don't normally think about, like are our pupils constricted or dilated? Are we salivating? Is our mouth dry? Etc. So again, all of these sort of unconscious bodily functions.
And Dr. Hamer, if you will and now explain for our audience, I have to deal with somebody with Georgia Power. If you'll answer for our audience, why is your parasympathetic nervous system such a key player when it comes to stress reduction? And we'll be listening to Dr. Hammer, and I'll be right back.
Sure. Well, again, when we are stressed, we have activation of the sympathetic nervous system, and it's often out of balance. In other words, our body is not in what we would call homeostasis or balance, because our sympathetic nervous system is not kept in check during these times. And this can happen from an acute stressful stimulus. Like, for example, we're at a party outside on a nice summer day, and there's a pool, and we hear a splash, and lo and behold, a toddler has fallen into the swimming pool. So we have immediate activation of our sympathetic nervous system. Lots of things happen in our body that prepare us to pay attention, jump in the pool, rescue the toddler. Our heart rate goes up, our blood pressure goes up. So we're pumping more blood to our muscles because we want our muscles to be activated. We're going to run over to the pool and jump in the pool. Fibers go to our brain to make sure we're awake and alert and activated. And so this is beneficial or adaptive during acute periods of stress. And it's okay to be acutely stressed. Stress can be instigated, as we all know, by some noise or a toddler falling in a swimming pool or some external stimulus. But our stress system, our sympathetic nervous system, can also be activated by our thoughts. And this is where we really get into trouble, because thinking about an acute stress, say it's 100,000 years ago, and our forebears are sitting around the fire in their cave, and there might be a saber-toothed tiger lurking outside the cave. They hear a roar, so they get acute activation of the sympathetic nervous system, or they're just thinking that there might be a saber-toothed tiger lurking at the mouth of the cave, and so their sympathetic nervous system is activated. This is an adaptive response. It prepares them to respond appropriately. And it's really okay to be acutely stressed, even if it's a thought that instigates it. So we think of something stressful like the list of things we have to do today, or, oh, I've got a meeting with my boss. It's okay to be stressed acutely. The key is how adaptive are our systems, largely our parasympathetic nervous system, to bringing us back into homeostasis, to bringing down our heart rate, our blood pressure, our cortisol.
This is so hilarious that we're doing our show today, because the interruption that we got was Georgia Power, and they basically told me that I have to pay for all the repairs on my house. I have to find somebody to fix it, a siding person and an electrician, and pay for everything. So I just am laughing at the whole irony of the situation. And that's laughing is good too. Does laughing activate the vagus nerve?
It does, actually. Yes, and because when you laugh, when you smile, if you can imagine you're stressed, you just found out you're going to have a huge bill to repair the storm damage to your house, your sympathetic nervous system is activated. Your heart rate goes up, your blood pressure probably went up, your blood sugar goes up. You feel like banging your fist against the wall, and your body's prepared to do that. But, by laughing, you can recognize that all these sensations in your body that come from the sympathetic side of your autonomic nervous system are subsiding. And that can only be because your parasympathetic nervous system is being activated.
All right, now with that, let's take a break and listen to one of our commercial sponsors here at UK Health Radio. And we'll be right back with Dr. Greg Hammer of GregHammerMD.com, learning how we can be not so stressed. So Dr. Greg Hammer, professor of Stanford University School of Medicine and expert on the vagus nerve. So it sounds like we all need to really understand our vagus nerve so that when we have storm damage or some other stress that happens, we can reset ourselves. So what are the long-term ramifications of chronic stress?
Chronic stress has just so many adverse effects on our physiology, on our bodies. So as I said, our heart rate's increased. So this represents more work that the heart is doing. Our blood pressure goes up. Again, more cardiac work. Our blood vessels throughout our body are constricted. And so that increases the resistance against which the heart has to pump. Again, more work for the heart. So the cardiovascular consequences are many. Stress on our heart, wear and tear on our heart, if you will, less oxygen delivery potentially to the heart as well. There are also ramifications on, excuse me, the hormone systems in our body. So for one thing, cortisol is activated. So there's a part of our brain called the hypothalamus. And when there's sympathetic input to the hypothalamus, when we're stressed, the hypothalamus secretes a hormone called cortisol stimulating hormone. And that stimulates another gland called pituitary to secrete a hormone called ACTH. And the ACTH gets in our blood and stimulates the adrenal glands in our abdomen to secrete adrenaline or epinephrine. We call it epinephrine in the United States, adrenaline in the UK, but I think most of us know what adrenaline is. So when that adrenaline is secreted, all of these adverse changes occur in our body. Well, they're adverse when they're chronic. They may be adaptive in the acute term, but maladaptive or deleterious when they're chronic. And so the cardiac effects, the effects on our heart, effects on all of our hormones. So even the hormones that regulate our hunger, certainly cortisol and insulin glucagon that regulate our blood sugar, sex hormones, all kinds of hormones, because when the sympathetic nervous system is activated and we're chronically stressed, think that our body is being prepared to fight or flee. So the blood vessels going to our intestines constrict. We're not really digesting our food, for example, because if we're really prepared to fight or flee, digestion is relatively unimportant during that time. So, so many changes occur in our bodies that are really deleterious. And when this is chronic, our immune system is also suppressed because cortisol, for example, does have immunosuppressive effects. Cortisol is really what the active ingredient, if you will, in drugs like prednisone that people take when they have autoimmune diseases, because prednisone, like cortisol, suppresses our immune system. So that's something that we certainly don't want to have on a long-term basis. So, we may be at risk for infection, cancer. So many diseases come from chronic stress. And as you mentioned, you have clients who have digestive issues that are exacerbated by stress, even if it's any kind of inflammation, inflammatory bowel disease, for example, that may be exacerbated by stress. So I think people with inflammatory bowel disease recognize that when they're stressed, their Crohn's disease or their ulcerative colitis tends to act up. So, you can almost think about any adverse change in the body, aging even. Chronic stress results in shortening of our telomeres. Our telomeres are little protective caps at the end of our chromosomes. I liken them to the little plastic coating at the tips of our shoelaces that keep our shoelaces from fraying. Telomeres keep our chromosomes from fraying and degrading. And as we age, they tend to shorten. We can combat that with exercise, diet, maybe intermittent fasting, certain supplements that we take, even drugs. But the main way to combat that adverse change in our telomeres that really represent the changes associated with aging is to diminish our chronic stress and hence the parasympathetic nervous system and the vagus nerve.
So this is such really important information. And I know that when I studied integrative yoga therapy, we had pages and pages and pages to read and study of all the signs and symptoms of stress in every single organ, right? And some of them may be easy or obvious, like your blood pressure goes up or you stop breathing. Now, let's talk about practicalities, because in order to get out of this chronic stress, we have to balance our nervous system. And in order to balance the nervous system, we have to activate the vagus nerve. So Dr. Greg Hammer, what are some simple methods that people can do at home to stimulate their vagus nerve and activate their parasympathetic nervous system?
Great question, because what we really want to talk about is what we can do about this situation where we're chronically stressed, where our sympathetic nervous system is sort of overpowering our parasympathetic nervous system. So how do we activate our parasympathetic nervous system through the vagus nerve? It's interesting. There are actually lots of different ways to do it. It can be done invasively with a surgically implanted vagus nerve stimulator. I don't think most of us want to resort to that. But under certain conditions, it may be very useful. We can immerse our bodies in cold water or ice water. Initially, that will actually cause acute stress and activate our sympathetic nervous system. If anybody's jumped into very cold water, they gasp. They can imagine their heart rate and blood pressure going up and so on. But when that subsides, there's sort of a diving reflex, and that results in the heart rate slowing down and activation of the vagus nerve and therefore the parasympathetic nervous system. So cold water. We have an infant or toddler who has a rapid abnormal heartbeat with an arrhythmia called supraventricular tachycardia. We want to activate the vagus nerve to break the supraventricular tachycardia and slow the heart rate down. We can put an ice pack on their face. So something that we don't, yes, go ahead. I'm sorry, Catherine.
So if someone wants to use the cold water method at home, can they take a cold shower or turn the cold water in the shower on? And how long do we have to be in the cold water?
Well, yes, you can take a cold shower or a cold bath. And as I said, I think initially there's a sympathetic activation. So, you can sort of think, how long does it take you to get accommodated or used to the coldness? So when you first get in it, it's a shock.
Mm-hmm.
But if you stay in it for more than 30 seconds or so, generally it starts to feel good. Your body gets used to it. So, I would say just even a few minutes is appropriate for activating the vagus nerve and the parasympathetic nervous system.
All right. So cold showers, cold baths. So, or we can just be in the shower and turn the hot water off and be in there for just a few minutes, right?
Right.
Okay. All right. And then you have
Yeah,
more great information for us. Okay.
but like as you and I were talking about before we started recording, another way to activate the parasympathetic nervous system is through slow, deliberate, deep breathing. And so when I do my gain meditation every morning, and when I teach it to medical students, residents, fellows, others, we get up in the morning, we open the blinds. I think that outdoor light activates our wakeful brain centers. We may do our morning hygiene and then find a comfortable place to sit, preferably a quiet place that's comfortable. And the gain practice is really just 3 minutes. So we sit down, we close our eyes, and we focus on our breath. We bring our attention to our breath. We breathe in through our nose slowly to a count of 3, where each count is about a second. So 1, 2, 3 on the in-breath, concentrating on filling our lungs, expanding our chest, but also expanding our belly. So we're sort of breathing into our belly. And then we pause for another count of 3. 1, 2, 3, with our lungs full and our belly expanded. And then we simply gradually let go of the breath without effort to a count of 4. And we repeat this 3 or 4 times. So basically what we're doing is we're taking a count of 3 plus 3 plus 4 equals 10. Our breathing cycle is 10 seconds. So our breathing or respiratory rate is 6 per minute, since there are 60 seconds in a minute. So we're lowering our breathing rate from 10 or 12 per minute to 6 per minute by taking these slow, deep breaths. And that it opens our lungs, those alveoli that are closed, representing atelectasis, whereby the oxygen in our blood is somewhat diminished. We're opening those little air sacs, those microscopic areas of our lung, increasing the oxygen in our blood. But relevant to this conversation, we're activating our vagus nerve. So as we do this breathing, and you know this so well because you've been a yoga teacher for decades, and I think the breath is so central to yoga and meditation in general. As we do this slow, deliberate breathing, we're activating our vagus nerve. We can actually feel ourselves calming down. So our heart rate's going down, our blood pressure's going down. Unbeknownst to us, perhaps our blood sugar is going down, and other wonderful things are happening in our body. So we're starting to feel calm, and that's when we get into the steps of the gain meditation. We then transition our thoughts to that for which we're grateful. So as you mentioned, we're grateful we live in a safe place. We're grateful for our relative affluence compared to others in the world. We're grateful for our loved ones, our community. We're grateful for this day, for being on the right side of the grass, as my friend Doug would say. So we transition from this parasympathetic vagal nerve activation to guided meditation, but we're in a state of parasympathetic activation that is really conducive to the meditation that follows.
Now, here we are at the Natural Healing Show for UK Health Radio, and we'll be right back with Dr. Greg Hammer about how you can get control of your vagus nerve so you can get out of the chronic stress that makes all of us so unwell. We'll be right back with Dr. Greg Hammer of GregHammerMD.com. So Dr. Greg Hammer, so you are a medical doctor and a professor at Stanford University School of Medicine. And here we are at the Natural Healing Show for UK Health Radio, where we talk about all the ways that people can heal themselves naturally. In your professional opinion, how big of an impact can holistic and non-invasive techniques like meditation have on our mind and body?
I think the benefits to holistic medicine are, cannot be underestimated. I think that holistic medicine is wonderful. And by holistic, I mean, and I think you mean, that we embrace all aspects that impact our health. And that includes diminution of chronic stress, terribly important, and something that we can control. We have to have a plan. The I in GAIN, for example, GAIN is an acronym for gratitude, acceptance, intention, and non-judgment, which I think are the 4 pillars of happiness and indeed holistic health. The I is intention, and that means we have to be purposeful about the way we live. So we have to focus on our mental well-being and become adept at ways to diminish our chronic stress, which is so unhealthy. But I think, I'm a huge believer in what I think are the 3 pillars of our physical well-being, which are sleep, exercise, and nutrition. And happy to discuss those, but I think those are part of our holistic health for sure. We really do need 7.5 or 8 hours of sleep a night. And so there's a whole field of sleep hygiene, and we can embrace several elements that are part of a sleep hygiene program. Exercise, hugely important. The right kind of exercise has so many benefits on our longevity. It lengthens our telomeres. It's sort of the antidote to aging, among other things. Our nutrition, what we eat, how we eat, when we eat, is critical to our long-term health and longevity. Supplements, I believe there are a number of supplements that are really beneficial, and we're starting to really understand the scientific basis of supplements and in terms of holistic health, in terms of our not just longevity, but the quality of our life, our health span, if you will. And then I think there may be drugs that are also helpful. So, I consider some carefully considered medications part of a holistic health plan as well. So, I'm sure that you probably know more about some homeopathic and other remedies that I am not well versed in. But I think these elements of sleep, exercise, nutrition, the right supplements, and in some cases, medications are really the components of a holistic approach to our health and longevity.
So I'm 64 years old. I'm on no medication. I just went to the doctor this week, and there's nothing wrong with me. They actually said I could eat a little bit. I'm not a vegan, but they said you could eat more protein in your diet. But other than that, it's like, this is the effects of natural healing. Now, you mentioned that you do a GAIN meditation, and I think this is so profound. And you said this is the foundation of happiness. What does GAIN stand for, again, for our audience? If you go through the initials, what does the G, the A, the I, and the N stand for?
The G is gratitude. Excuse me. Gratitude is intrinsic to happiness. We can imagine somebody who's poor and happy, somebody that has a hole in the side of their house who's happy, somebody who may be physically challenged and happy, but you can't really even imagine somebody who's ungrateful and happy. So gratitude is huge. And again, I'm not making these up. These are not my own. It's not as though I've discovered these elements. They're really part of every important and beneficial religious and philosophic tradition. Gratitude is key. Acceptance is the A in GAIN, and acceptance means that we acknowledge that life is not all pleasurable. There is pain and suffering, and these are intrinsically as much a part of our lives as joy and happiness. So the point is that we don't want to resist these, that we do want to acknowledge them, and we do want to actually focus on them at times. And so during the gain meditation, we contemplate our gratitude, perhaps for 40 or 45 seconds. Then we move to acceptance. We may imagine some uncomfortable or painful experience, and we imagine bringing this experience closer and opening our chest and opening our heart and bringing this experience into our heart, enveloping it with our heart, nurturing it with our heart. So eventually we can ask ourselves the question, can I live with this pain forever? And the answer is yes. And this is critical, because when we try not to think of these uncomfortable experiences, it's really a form of resistance. And that's the opposite of acceptance. And, you know, there's a formula in my first book: suffering equals pain times resistance. So the pain is there and inevitable, right? I lost my son at the age of 29, 6 years ago. That pain is not going to go away. But if I lower my resistance to it, if I bring it into my heart, the suffering is diminished. Suffering equals pain times resistance. You know, we love formulas in medicine. So it's really important to embrace even these uncomfortable experiences and feelings that we have. And then we transition to the I in gain, which is intention, because, you know, this could be a subject of a whole hour in and of itself, but our brains are wired in ways that appear to interfere with our happiness. We have a negativity bias. We all do. We are very distracted by the future and the past in ways that are maladaptive. And when you combine this obsession with the past, this ruminating over things we said that embarrassed us or we think are embarrassing, we generate a lot of shame. When those thoughts are combined with our negativity bias, we feel shame, regret, low self-esteem. We feel the imposter syndrome in many cases. And this is something that even I experience. So when we overthink the future, when we obsess about what is to come, combined with our negativity bias, we generate a lot of fear and anxiety. We catastrophize. So this is the way our brains are wired. The good news is our brains have this magical quality called neuroplasticity. We can actually change the way we think and feel and experience life, but it takes a plan. It takes purposefulness or intention. So we contemplate our current experience. It could be the pressure of the chair against our body, the sound of a mechanical device in the distance, which I don't know if you can hear it, but I think they're sawing a tree down somewhere in the distance of where I am in Carmel, California. But in any case, we focus on the purposefulness of guiding our thoughts and our experience. And then the end in gain is non-judgment, because we're always evaluating and judging things in our environment, other events, people, and most notably ourselves. We are our own most harsh critic. And so we're very self-judgmental. And again, our negativity bias creeps in, and we tend to judge others and ourselves in a negative manner. And so we can learn to drop these judgments, because when we're judging, we're not seeing things clearly as they are. We're seeing them through sort of a tinted lens of our own bias and our own thinking ways. And so we can learn to drop those judgments and just see things clearly. You know, not everything is good or bad. And we ourselves are neither good nor bad. We're just a human being with our flaws and our wonderful attributes as well. So non-judgment is extremely important in terms of happiness and indeed our health. So then after we contemplate our ability to drop the judgments, we go back to focusing on the breath, slowing it down. And we're really learning to focus on the breath throughout this exercise, throughout this meditation. And then we slowly open our eyes and we're ready to go out in the world.
I love that. This gain meditation, gratitude, acceptance, intention, and non-judgment. That's just beautiful. So, and this is the gain meditation technique is something that you recommend that helps us activate our vagus nerve, correct?
Absolutely, because when we're doing this practice, if you think about it, even just focusing on that for which we're grateful. Okay. So we're sitting and, we stop doing what we're doing on our computer or whatever. And, we just think about what a wonderful life we have, how fortunate we are to live where we do, in a safe place with a wonderful home in which to live. We have enough food to eat. And, maybe we're sitting at our computer and we're, looking at our homepage and reading about all the terrible things that are going on in the world. And we pause to be grateful for our own circumstances. And again, we do have this negativity bias, so we tend to kind of whine and complain. But when we let go of that negativity and we just exercise the gratitude centers in our brain, we can feel our heart rate going down. We can feel this sort of sense of calm coming over us. And so, yes, contemplating gratitude, but indeed acceptance, intention, and non-judgment as well, they bring us a sense of calm, a sense of wellness. And it's sort of a self-propagating loop, if you will, a positive feedback loop. The more we focus on our gratitude, we're rewiring our brains to be more grateful. The more we focus on non-judgment, we're actually training our brains, we're rewiring our brains to be less judgmental, including self-judgment. So this is a wonderful way to approach the world. And the sense of calm that we're experiencing is really, in part, activation of our parasympathetic nervous system.
So this is quite profound. Now, Dr. Greg Hammer, professor at Stanford University School of Medicine, an expert on the vagus nerve, how much time do you think people should spend every day to focus on meditation and mindfulness?
Well, that's a great question, Catherine. A lot of people feel that meditation means you have to sit still, possibly in an uncomfortable position for 30 minutes at a time, and that you have to banish all thoughts from your head. Very few of us can do either one of those things. So that's why the gain practice can be done in as little as 3 minutes. So here's the magic. We get up in the morning, we, as I said, open the blinds, we do our morning hygiene, we find a comfortable place to sit, we close our eyes, we focus on the breath. We then transition our thought processes, our focus, to gratitude, then acceptance, intention, non-judgment, return to the breath. And then we open our eyes and begin our day. What happens with this practice is that when we're walking down the hall feeling stressed, I'm going to have a meeting with my boss, I feel my heart rate going up, I feel my sympathetic nervous system being activated. All I need to do as I'm walking is reorient my focus to my breath. Start to take slow, deep, deliberate breaths through my nose, pause even as I'm walking, and then let the breath go without effort, slowly to a count of 4. When we do this, all of these other elements come to us. It's a conditioned response. So we associate these deep breaths with gratitude, with acceptance, with intention, with non-judgment. So the more we do this practice, for example, the more these wonderful parasympathetic feelings, if you will, come to us naturally. So we can just initiate focus on our breath, slowing it down, deepening it, and all of these other experiences come to us, the experience of gratitude, etc. And so we're driving in our car, we've done our gain meditation, we've had a cup of coffee, we're getting in our car, we're driving to work. And as we're driving to work, a driver in the lane to the right of us suddenly changes into our lane in front of us, not leaving much space, and without using their turn signal. And we begin to form all these judgments about how inconsiderate they are, this and that. And a light bulb goes off. And we recognize, I just did my gain meditation. I pledged to drop the judgments. I don't have to render this driver in my thoughts as good or bad. It just is what it is. So we drop the judgment and we get a little hit of dopamine. You know, it feels good actually to drop a judgment, because judgment represents a little negative experience. You know, we may not recognize it, but when I'm thinking, oh, what an awful person that is, I'm bringing myself down. You know, I'm actually putting myself in a state of greater negativity. So when I drop that judgment, I get the benefits of positivity. You know, the hormone dopamine or serotonin, I get a little hit. It's pleasurable. So again, it's the association with our breath and these other elements that are really the pillars of our happiness that become natural to us. So the more we do this practice, the more natural it is for us to be grateful and drop the judgments, etc. So it's actually a very, very, very wonderful, magical practice.
You've been listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. Our wonderful guest today has been Dr. Greg Hammer, an expert on the vagus nerve, professor of Stanford University School of Medicine. And you can find out more about Dr. Hammer and his wonderful work at greghammernd.com. And remember, when you activate the vagus nerve, you get out of pain, you get out of stress, and you begin to heal yourself naturally at very deep levels. Thank you so much for listening, and we'll see you next time.